Good evening, everyone. Welcome to today's Instagram Live. Today, we are going to discuss an aspect or another side of therapy, which is very different from as therapy is typically understood. A lot of people think of therapy as when I'm going through a problem or when I'm going through some form of a difficulty in my life, is when I reach out for counseling. But today's discussion is about two such phases of our life where counseling is considered or seen as in a more preemptive form, that before I enter these phases of my life, I reach out for counseling to prepare myself. And as is obvious, the two phases that we are talking about, one of course is the phase of marriage, when we're deciding to get married, and the second is when we decide to get into parenthood. Two such very important phases that almost change a lot of things in our life, change the dynamics of how things would be, and require for us to adapt to life from there. Sorry, give me a second, please. Okay, sorry about that. Yes, so require for us to adapt to life from there. And in order to take this discussion forward, I thought it was best to have with us, a gynac also, because like I would like to address and talk about pre-marital counseling. It is important to have an expert discuss with us pre-parenthood or pre-conceptual counseling. I'm going to invite Dr. Ankesh Sahitya, who is an eminent gynecologist and also an old friend, and discussion forward from there. Of course, welcome everybody. I'm happy to see so many of you join in, and please feel free to give us your questions or anything. Hello, Dr. Ankesh. Hi.
Hi Rashi, how are you?
I'm good. How are you?
Good to see you always.
Yes.
How's
Hi.
everything?
Very well. Very well. Okay. So,
So
like I
I,
was.
I heard you. I heard the topic is pre-marital and pre-conceptual counseling. Such an important topic. It's always important to make a good choice as far as your life partner, your marriage goes. Getting married, making a decision of your life. Then once you're settled in marriage, to take on your family name ahead and have your progeny, pre-conceptual counseling is even more important.
Yeah.
So both are important. So Rashi, you being such a busy psychologist, can I ask you one question?
Hmm.
Can I
Go
go
ahead.
ahead?
Yeah, yeah,
Yeah.
please, please.
So the term marriage counseling or premarital counseling is very familiar and understood by few.
Hmm.
Can you explain what comprises of premarital counseling and
Hmm.
who are the people who are most likely to choose and go for this option of counseling?
Right. See, premarital therapy or premarital counseling is a specialized area of therapy that is largely focuses on preparing individuals or couples for their marital life or for the interpersonal relationship that lies ahead in marriage. Of course, by participating in a process such as premarital counseling, couples are able to strengthen their foundation, if I may say, the foundation that you sort of set for your life ahead by learning how to build healthy, strong relationships, by overcoming some issues that may be there, either individually for them or between the two of them. And as most of us understand that a lot of times parents or immediate family well-wishers try to guide the children who are going to get married, that this is what you should do. But the premarital counseling that we're talking about here is best when it is attended to by a expert who understands human emotions and behavior, who has experience in dealing with marital as well as family therapy. So that is, of course, what premarital counseling is about. Your question, Dr. Ankesh, about who opts for it. while I was talking with reference to couples, it's not always that only couples come in. Sometimes even individual men and women who who have, who are seeking matrimony, who want to get married, but may have some reservations, may have some sort of complications or something that they want to work on themselves, is when they reach out. And also sometimes, I mean, nowadays it's so common, people have 2 or 3 relationships before they decide to settle into marriage. So there is also emotional baggage or some sort of a traumatic experience or things that they want to resolve before they prepare themselves for marriage. So it could be individually, my own individual work for more readiness for marriage, and it could be as a couple also, for us to align a lot of things together and learn a lot of aspects, which of course we'll discuss as we go forward in today's discussion. So that's premarital counseling. But extending this to your area and your field of work, I do believe that while we focus on the interpersonal or the psychological and emotional aspects of premarital counseling, I do believe that there's also the physiological or the physical aspects of it. And as a gynac, is there something that you would recommend or you suggest as couples should look into before premarital, not preconceptual, but premarital, even if there are certain tests or, nowadays people are particular about getting these things done. So what is your observation or your view of that?
Yeah. Thank you, Rashi. So I want to say hello to all the listeners who are there today. Thank you for taking time out today on a Saturday rainy evening in Mumbai. Sachi, the question is very straightforward. You've asked me. So medically, as far as the reproductive criteria, any couple looking to get married. So we've had a girl walking into our clinic telling us that she's getting married to somebody who she's met via matrimony, arranged marriage, or via her partner. So it could be a lover arranged thing. That doesn't matter. So if the girl has any form of disorder, genetic disorder could be thalassemia, hemophilia, color blindness, cystic fibrosis, the list goes on. There's a long list of genetic factors. So these factors are themselves not harmful to the girl who's become 27, 28 or whatever age is. But if her partner has the similar condition, so this could be recessive. Yeah, this could be recessive in her. But both of them getting together, sometimes there's almost a chance of having almost 25 to 50% of having a fetus, a progeny with the major factor. Like for example, thalassemia minor. If both the partners have thalassemia minor, the child has a 25% chance of being thalassemia major. Similarly for hemophilia, for color blindness. So these are all genetic X and Y linked disorders. So the first thing is genetics. I would tell the patient to be sure of that. There are various communities like Lohana, Sindhis, Kachis who are prone to thalassemia. So I would go on the caste, matching the genetic conditions. Also, more than this is the age. Now, obviously we are assuming a person of marital age will come to us, but someone being very young, let's say in their early 20s or their teens, just after 18, we would tell them about the complications that it can have when you're young in age, and what about pregnancy in a young age. Similarly, a very old patient, someone who's, let's say, for example, in their late 30s or early 40s, we have to tell them that you're getting married. About childbearing, it could be this problem, that problem, about having a child going into labor. There are various aspects of reproduction if you're in your early age or late age over there. Similarly, the patient has to have her weight in check. If she's going to get married and eventually plan a child, we'll ask her to maintain a good amount of weight, some personal fitness. Besides that, you look for any morbid conditions in the patient. If she's ever had diabetes, blood pressure, any family history, she can even check on that. Any heart disorders, things like that. And besides that, premaritally, I would not look more than this. I have a lot more to say preconceptually.
Yeah, I do get it, because people are becoming very responsible or proactive nowadays. I mean, I do know that there's a long way to go. There's so much that we do towards preparing for the wedding, of how you want your ceremonies to be and what you want to look like. But there's very little preparation people do towards marriage, whether it is our interpersonal things or our plans for the future in terms of, conceiving and how and when we want to do it and those factors. So that's a very valid point, that this is a very, very important area that people can, should rather also explore before they decide to tie the knot.
Absolutely. So, Rashi, now what I wanted to ask you is that we see that some people are great when we talk about a relationship. Like, for example, let's say now, let's be honest, now we are in the 21st century. So there are couples who've been sexually active
Yeah.
premaritally, they've been living in together, some parents knowing, some not knowing, they've been living together. But
Yeah.
when the idea of marriage or the ring or the commitment comes up, uh, can this fear be ridden by premarital counseling? One is that. And can you, give a little idea on the advantages of doing a premarital counseling? So regarding the fear of commitment, and
Yeah.
secondly regarding what would you think that how would this help someone like this?
The fear of commitment, as is typically understood by people as like a commitment phobia, as they say. I think that with the with the increase in divorce rates, or the kind of conversations that are becoming normal, very normal now, for people to say, oh, there are issues, and everybody kind of knows someone who's having some sort of marital issue. So people, young people get very discouraged, and they start asking themselves questions such as, why should I marry? Or what is the purpose of marriage if this is what is going to happen? So sometimes that, and then just the thought of being able to prepare yourself or go through the conversations around marriage, to go through the conversations about how we're going to accommodate or adjust with each other, a lot of these things give anxiety or instill a lot of doubt in people. Because with late marriages, people are, they've kind of developed their own individuality, and there's a fear of letting that go. So when people say commitment phobia, very, very casually used term, it is somewhere coming from these factors, which of course can be can be dealt through in marital counseling, premarital counseling, because that is something that each person needs to process, where their fear is coming from. Sometimes you may have seen a very close family relationship, could be that of your parents, or could be that of a sibling, that has not worked out, and that has influenced you, or that has influenced your concept of trust. So this is a very, very important area. In fact, anybody who feels that they have a commitment phobia, whether they are or are not planning to get married in the near future, should reach out for premarital counseling, because in many ways that affects or impacts your married life later on, or your sense of commitment. About the key advantages, I would like to, there are umpteen, but I'll just like to summarize them in a few ways. One, of course, is that other than a circle of friends or family, a premarital counseling session will provide you a safe, unbiased, non-judgmental environment to discuss your own issues, and any sort of interpersonal issues that you're having with your partner, your fiance, your boyfriend, your girlfriend. So that's the first advantage, that you get that space to talk about your issues and resolve them before you enter the wedlock. The second advantage, to me the most important, is to be able to learn skills, core, I would say, communication skills and conflict resolution skills. I think these two things, how you communicate and how you resolve conflicts, is so different for each person. Coming from our own personality, we have our own dominant way of doing it. So important to become aware of your own pattern and that of your partners, accept it, learn from it, and adapt to it before marriage, so that you're not in for a shock or a surprise, or you're not in for constant issues in the marriage. And third, there are many supplementary factors when you get married, right? There is finances, there is planning a child, there is family dynamics, there's your career goals. So a counseling environment can help you sort of discuss those things also in the premarital counseling session, and you're able to align yourself with that of your partners, even your value system, and many other things. So these are, according to me, the core advantages. Of course, coming from the mental health field as a counseling center, we also have certain preset programs that addresses some of these issues, whether it is expectations or real adjustments, and many such factors that we address for people who are in the process of getting married, that will help them whether they are coming in individually or together. So these are some of the things that we highlight as the marital counseling advantages. But like we talk of premarital, and like I said earlier in today's when we started today's discussion, that these are two phases of life, both before marriage and before you enter parenthood, that require some sort of skill building or some sort of information that each person sort of needs to learn and understand. So from a preconception point of view, which is the next stage, when one moves from this, sooner or later, depending on their own life goals and plans, they come to that stage where they want to be prepared or want to learn about preconception. What all, according to you, is covered in preconception? Is it only about how to go about the conception, or is there more to it? And how important would you say it is? Because I do realize that even in sessions there are many people who keep going on the struggle of trying to conceive without even reaching out to a gynac, and that causes a lot of anxiety and a lot of stress between the couple. So how important would you say is preconceptual counseling?
Yeah. So I like your answer a lot on premarital counseling, by the way. Great answer. So Rashi, I would answer your question in two parts as you asked me. So pre-conceptional counseling, again, is they're entering the second phase of their marriage. First getting married, getting to know each other. So pre-conceptional counseling, I would say broadly, has four components. The first is the couple should be spoken to regarding the full idea of pregnancy, if they are planning a pregnancy via, some cause of infertility or fertility, or just they want to try naturally. The most important is the maternal assessment. You, again, as I already mentioned, the genetics of the couple, the mother specifically, any medical surgical illness. If the mother has any illness which could get exaggerated because of pregnancy, like blood pressure, diabetes, heart disorder, respiratory disorder, you cannot plan a pregnancy for a woman if she has any high risk factor. You can with precautions so that there's no problem in the pregnancy or to her health during the pregnancy. You have to ask her for any history of any over-the-counter drugs. If she's been taking, some people have a habit, they go to the pharmacy, pick up a Crocin, pick up a Gelusil, pick up any form of thing, and they have medicines. In today's generation, there's no harm in saying even substance abuse. People are smoking, drinking, they're having smoking up marijuana, various things. So that's something I want to cover up in maternal assessment. The second thing, which is so common today because people are polygamous, let's be honest. Again, screening the couple for STDs, STIs. This is the most important factor because there's no point of giving birth to a progeny if you already have any STD or STI. You are only making it worse for the child from conception. Also, you look into the mother's history. If she's already previously had a child, secondly, any history of previous miscarriages. Now that goes into bad obstetric history and recurrent pregnancy loss. Such a patient might even require counseling. I would have to send a patient like this to you for bereavement counseling, to debrief for things like that. And the genetics I mentioned. The third component is counseling. Now, counseling at my level would be for her weight, to maintain her BMI, for her habits. Upper level counseling, I would refer to a psychologist. Also, the fourth component, which many people forget, is vaccinations. Now, not the vaccinations during pregnancy. Now, there should be immunity to various conditions and should be vaccinated. And the pregnancy planning should be postponed by 3 to 6 months. Check for the immunity against rubella, varicella, chickenpox, hepatitis B, influenza. In various countries, they don't let you plan a pregnancy unless you have antibodies against these four conditions. So that's what I would tell anyone. You should have immunity against these four conditions. In our country now, rubella and influenza have become a standard in various multinational and corporate hospitals. Now, why, you ask me in the second question, why is preconceptional counseling important? On a normal basis, like let's say over the last 30, 40, 50 years, we've heard our parents, grandparents just got pregnant and they went to the hospital and delivered. Now, we don't know what they underwent before they delivered their first healthy child or second healthy child, whether they had any problems. Now, the most common issue, which is never spoken commonly, is preterm births, preterm delivery, giving birth to premature children. So if you have preconceptional counseling for all the factors I mentioned, for all the conditions like blood pressure, diabetes, are all taken care of, preterm births is the first thing that is ruled out completely. Also, having a child which is preterm increases the load of NICU stay, infant mortality, morbidity. This is not very good in the development of the child when the child is just born. Third thing is, you can prevent umpteen number of complications if you're knowing the patient and the husband's blood group, their genetics, their entire physiology, their blood pressure, their sugars. If you know all this, you can prevent so many complications that you will have so much less to worry about in the future.
Right.
And I would always say that even if they have no issue, it educates them and it gives them a know-how. Getting into parenthood, you and I both know getting into parenthood is no easy thing. You have to be prepared. There are so many responsibilities. So you just can't walk into a clinic and say you want to have a child. They should be aware that planning a child means a 9-month long pregnancy. Pregnancy is a mixed bag coming with its own sets of pros and cons. A woman
Challenges.
goes
Yeah.
through so much. Plus, the financial aspect cannot be overstressed in today's day. Also, I would say it would educate the patient and give the patient a form of a trailer for the movie that's coming up. And I've always believed a healthy woman forms a healthy mother, and only that can form a healthy baby. So this is how I would summarize. And besides that, nothing. If you have a good counseling preconceptionally, if you get time, you can work on a nutrition, you can work on the healthy environment, the bond between the husband and the wife, education. And during the planning, they should be aware that certain things are important to be solved. Otherwise, it could lead to complications. And in the end, the ultimate goal of the couple and the doctor is a healthy mother and a healthy baby, or better still, a healthy couple and a healthy baby.
And you would then say that having this information, like we say in case of premarital counseling, having information or having the skills or having the right methods beforehand, and sort of empowering or equipping them with those that information always helps to ease out the process and reduces the
100%.
complications.
So when I was in school, Rashi, I heard a saying. It was called the 6P theory. Six, the number 6 and P. So it went like this: prior, proper, planning, prevents, poor performance. If you have the 6 P's in life, you are sorted. Also,
Yeah.
one quote by Abraham Lincoln: if I had 8 hours to chop off a tree, I would spend 6.5 to 7 hours sharpening my axe.
Yeah.
So I've
To
always
learn
believed
how
if
to do it.
yes,
Yeah.
you plan things, you decide, you plan the time. If you're not financially stable, if you not fully settled, if you
Yeah.
feel there's conflict, don't have a child. Now
Yeah.
there's a myth in India that bachcha kar lo sab theek ho jayega.
Yeah.
Not
Which
at
is
all.
actually a lot of like the work that we do in terms of marriage counseling also comes from there, you know, that people want to have a child and parents or in-laws or societies that are putting this in their head that go ahead, just have a child and it'll be okay. But actually then that is when couples come in to say that no, we want to work on our marriage because we can't do this till we are not together or on the same page. But I really like what you said in terms of the preparation, or
Yeah,
in, you know, sharpening the axe. What I mean, think of it like this: when you were saying that, what occurred to me is that we all go through education and, you know, train ourselves, invest how many years in training ourselves and learning skills for our jobs and for our careers, and the job or the career lasts me like some 25, 30 odd years. But whether it is my marriage or it is my responsibility as a parent or it is my physical health also, all of these things last me much longer than that 30, 35 years, my
yeah,
entire life,
absolutely.
including those 30, 35 years. But we do not invest, I mean, most people do not invest the right amount of time to learn the skills for that, you know, whether it's for
Excellent,
premarital
excellent. I
counseling
agree
or
with you.
preconceptual. Somebody
Very good
asked a
example.
question that I'm just going to take up in a minute.
Sure.
Someone asked a question about counseling, saying that if the partner is not ready, does single person counseling also helps? I don't know the context whether you're asking about premarital or post, but I have to say that irrespective, there are a lot of times that only one person comes in for counseling, only one partner comes in for counseling, and it does work because, like two wheels of a motorbike, each one, even in therapy, does their own part or contributes in their own way towards the relationship. So there are times when only one person's coming in for counseling and they come back to say that, you know, are you talking to my partner because I see changes in them? The changes in them are happening because you're kind of working on yourself and realizing certain aspects, and that is what is making a shift in the relationship, irrespective of whether they are coming or not. Of course, it's always best case scenario if both come, but a lot of times single people come for premarital as well as postmarital counseling.
Yeah, agreed. No, excellent. I like your example of saying we prepare for years for school, for college, for
Yeah.
our job for 50 years. But
Yeah.
I don't know about the other countries, but in a country like India,
Hmm.
uh, you know, there's a saying that you're never ready for marriage.
Yeah.
And even the kids don't come with a manual. Everyone has a different experience. As the child grows up, as a newborn infant, every day is a new day. you learn new things, you have different fears, you overcome them. Marriage, I would say, if you get to know your partner well, if you're on the same page, now, how much ever you guys get along, how much ever similar you are, there's no perfect or complete relationship. There's no
Yes,
marriage
of
that's
course.
perfect. Yeah. So I've always believed if someone's, now on social media, though obviously you can't make out everyone looking so happy with their couples and all. We don't know the picture behind the picture.
Yeah.
So I've always believed if someone is saying their marriage is beautiful, they are very happy and all, there are two possibilities, Rashi. Either they are lying or they don't know what perfect means. So I believe it's always going to be give and take. Marriage is like you have to have a good friendship first. You have to always be ready and understand that it's adaptation is the key.
Yeah.
Compromise is part of life.
Yes.
So everyone doesn't get the exact thing they want in life. Everybody has to expect that, like marriage, like anything in life, like your exam score, like your set of friends, nothing is always perfect. There's going to be
Exactly.
some good
So,
days and bad days.
premarital counseling also is not about ensuring that you never have issues in your marriage. It's also about helping you with the skills to make that more manageable, whether it is your value system or your ideas about, life goals, or even how you choose to communicate with your partner, how you choose to communicate about important life decisions. You align with your partner on that, and it just helps you to cope with the difficulties, cope with the challenges as and when they come. It equips you to cope with them in a much better way, in a healthier way, because you've sort of learned those skills. So honestly, before marriage, if there's one gift that you can give to your spouse or can give to your fiance, would be to kind of go out there and learn about these things together.
I
And
can't
that
agree
would be
more.
the
I wouldn't
first
agree
thing
more.
that you could do together as a couple, for yourself and for the other person.
Excellent, Rashi. I
Yeah.
always believe that, communication is the key. There's no harm going to a friend, a counselor, a psychologist, a
Yeah.
psychiatrist, whatever you have in front of you. Go speak out to make a decision, an informed decision about your life.
Yeah.
You have to be sure. And I think counseling, knowing what you get into,
Yeah.
now, now, for example, there are various joint families. Living in a joint family, living with your in-laws, living with maybe a sister-in-law, brother-in-law,
Yeah.
you have to adjust. We don't have the
Right.
largest houses in Mumbai, in India.
Yeah.
So accepting that, adaptation, compromise, and I think it's give and take. And like how they say, nothing in life is perfect. You have to make it perfect. And marriage,
Right.
I would say, it's two imperfect people
Come
refusing to
together
give
to
up
make
on
it.
each other.
Yeah, we're talking about two areas where we are sort of addressing the younger audience, right? And this age group and this population is one that is most comfortable when they have control or when they have information, which is why they go online and they Google stuff and they get the information they require. Whether it is for before marriage, for planning your wedding, or it is for planning your marriage and your interpersonal relationship, or it is for becoming a parent. I'd say it's a great thing to inform yourself, to have information, to research, to prepare yourself, but just make sure that you do it with the help of a professional and not with the help of, hearsay, just things you've heard of people go through, because their experiences are not your experiences, their situations are not your situations. So when you reach out to a professional, they give you the solutions, they give you the guidance that are absolutely apt for you. In our case, your emotions, in your personality, in your case, your body and your genetics, if I may say. So very important, and the purpose of this session also was that premarital, preconceptual counseling, both so important, and so important that people realize and become aware of reaching out for professional guidance for it. And absolutely no harm, absolutely no shame or no guilt in thinking that I need help for this, because I am only helping myself with the right skills before I get into it.
And
Yeah.
one last point, I just don't mean to cut you, Rashi. I
No,
want to
sure.
add something. Any couple comes for premarital counseling and preconception
Hmm.
counseling. I want to imply one thing, that everyone is different.
Yeah.
Everyone's having a different maturity.
Hmm.
Now, the issues which I have faced, I've seen in practice, I've seen around personal friends everywhere, is that people complain that, oh, he's very immature, she's very immature. I've always believed that everyone's work in progress.
Hmm.
Also, I've always believed that if a couple is the same age, this is my experience, the girl tends to be much more mature than the guy. I don't know if this is biology or this is the
Okay.
normal
Yeah.
development. Yeah. So I would say, if you're getting into marriage, get your maturity on track first. If you're having a child, get your maturity about the responsibility of raising a
That will
child
come
first.
along. Yeah.
So if you worked on your maturity, you have to see. I'm not saying you can change your partner. You can change. First, change yourself. Accept what is happening. Accept your partner.
Yeah.
If you put in the efforts, your partner will understand and value you even more.
Yeah.
So, and I've always believed that if you appreciate if someone is changing, I've always believed in one mantra: appreciation is the best motivation.
Yeah,
So
that's
that's something I
true,
wanted to.
because both these phases of life actually bring along with them a lot of new responsibilities and a lot of
Yeah.
things that you have to adapt to. And if you can prepare yourself and be on the same page with your partner and come into like understandings of what is going to happen and how our lives are going to change and how we are going to be together through it, it can just make the journey easier, whether it is the challenges of a new marriage or that of parenthood. That's absolutely right, the point that you highlighted. Thank you so much, Dr. Ankesh. It
Thank you,
was a
Rashi.
very good
It
discussion.
was a pleasure conversing with you. I remember studying with you in Andheri Recreation 15 years
Yeah,
back. And
yeah.
I can only say you've gotten much more calmer. You were already very calm. And talking to you is like talking to an old friend. And I really had a good time.
Thank you, thank you. That was really long ago when we were still students, and thank you for
Long ago.
remembering. Yes,
So
yes.
Rashi,
Thank you so much.
if you can just save the IGTV and share
I
the
will.
link.
I
You
will.
can tag me
I'd
in
like to
your
thank
page.
everybody who joined us live, and I
Yeah.
would be happy to save this for everyone else to view at a later time. I'm sorry, I may have missed out on a question or two, but if I have, please feel free
On
to
the inbox,
DM.
they can
Yes,
reach
please
us.
DM
Yeah, they
us.
can
If
DM
I have
us.
missed out on anybody's question in the flow of
Yeah,
the
yeah.
conversation, please
Sorry,
DM us.
sorry if anyone we missed out, but we want to keep it short and crisp. And you can
Yes.
reach us. Rashi is very active and helpful, and I'll try to do the same as her.
Thank you. Thank you so much, Dr. Ankesh. Thank
Bye,
you.
Rashi. Thank you.
Bye.
Bye. Good day. Good night. Yeah.